In general, what technology has the promise of doing is eliminating costs, providing better access, and reducing time constraints for anyone who participates in those clinical trials.
Welcome to For the Health of It, our series where we bring together some of the world's top scientists, analysts, and health experts to discuss some of the biggest challenges in healthcare today. I'm Bill Evans. For today's episode, we're excited to be joined by Kenneth Mendez, President and CEO of the Asthma and Allergy Foundation of America. So social determinants of health are a huge piece of this equation. What can we do to get patients to seek care earlier or get better disease management so that they can get the best care possible in the near term?
On a community level, it's getting into homes, looking at housing, getting further upstream, even before people need to take medications, to make sure that people understand what the triggers are for their asthma. And unfortunately, for racially and ethnically underserved populations, sometimes housing can be a real challenge.
So what role do data and technology play for disease management or ways that can ultimately benefit the outcomes for patients?
Sure, there's so much technology out there, wearable technology. I'd say data collection is really important on a national scale to have it centralized. So when you're doing clinical trials, when you're trying to formulate payment policies, all those things can be wrapped into one central data source. In general, what technology has the promise of doing is eliminating costs, providing better access, and reducing time constraints for anyone who participates in those clinical trials.
Shelter-in-place orders have been critical to flattening the COVID curve. But as we've talked about on this show previously, it has also kept many patients away from routine care appointments. How are you encouraging your constituents or prospective patients in general to stay ahead of disease management in these areas?
Sure, that's been a real theme for us, drinking from a fire hose for the last 12 months or so. But the first thing is take your medication. That's the most important thing. A lot of people were reluctant to get their medications or go out, but you need to maintain your asthma medication. And the other misconception that's come out is that people with asthma can't wear masks, and that's not true. If you have well-controlled asthma, you should be able to wear a mask. If you are having trouble breathing through a mask during COVID-19, then you probably need to see your specialist because your asthma is not well controlled.
So on that note, the theme of this year's Asthma and Allergy Awareness Month is dispelling myths just like that, to help people better understand the impact that these conditions have on communities. What are some other myths and what can people do to help educate others about asthma and allergies?
Sure. I mean, there are a couple of them. First off, some people think that asthma is a childhood disease and you can outgrow it. And that's absolutely not the case. I had asthma as a kid. I didn't have it through my 20s, which was only a few years ago, but now I have it again. So, it could always come up even as an adult. Some people think that it's infectious and it's not. So if you have a respiratory infection or something like that, that could trigger asthma. That some people think that you can't exercise if you have asthma, and that's not the case. You can exercise if you have asthma, if it's well controlled. For Awareness Month, we release this every 2 years. We look at the 100 largest cities and the ones that are most challenging to live in with asthma. We look at 3 indicators for those rankings. One is asthma prevalence, the other is mortality, and the third one is emergency room visits. So if you score high on all those, you will be high, unfortunately, in the rankings. And the top 5 for this year are Allentown, Pennsylvania is number 1, Baltimore, Maryland, number 2, Richmond, Virginia, number 3, Milwaukee, Wisconsin, number 4, and New Haven, Connecticut, number 5. Health disparities cost the healthcare system about $135 billion each year. So there is a cost to disparities, in addition to just addressing them because it's the right thing to do.
For news, updates, and to learn about future episodes, you can follow us on LinkedIn and Twitter. This has been For the Health of It. See you next time.